Hello, this is Dr. Dal. I'm going to talk about depressive disorders. Mainly, there is major depressive disorder, bipolar disorder, dysthymic disorder, cyclothymic disorder, seasonal affective disorder, and depressive disorder not otherwise specified. Those really cover most of the depressive disorders. Under bipolar disorder, there are different types, bipolar 1 and 2, and there are some people talk about different others, number 3 and 4. But I'd like to focus primarily on symptoms of depression. For someone to meet the criteria for major depressive episode, which is a requirement for clinical depression, they need to have 5 of those 9 symptoms that I'm going to talk about. And those 5 or more symptoms needs to occur almost every day, most of the day, most days of the week, at least 2 weeks. It can be obviously longer, but it needs to be at least 2 weeks. The first and most important one, depressed mood, feeling down, depressed, sad, most of the day, most days of the week. And that needs to be a change in person's mood. The second one we call anhedonia, or lack of pleasure in any activities, in hobbies or other daily activities someone used to enjoy. They lose that joy, that inner feeling of happiness. Even they do the activities they used to enjoy most. Then after anhedonia, we need to focus on physiological symptoms of depression. One of those would be decreased appetite, associated with, also it can be increased appetite, and that is associated with up to 5% change in someone's total body weight. So if someone is really 150 pounds, that needs to be 7.5 pounds of weight change, more or less. It can be increased or decreased. Another symptom is insomnia. And typically we divide insomnia into 3 different types. One is sleep onset insomnia. Person has difficulty to fall asleep. The second part is middle insomnia or broken sleep. Basically, the person wakes up more than once or twice per night, most nights of the week, and they have difficulty to fall back asleep. It can last half an hour or longer to fall back asleep. The third type of the insomnia is early morning awakening, or someone wakes up not feeling rested, refreshed, still feeling tired, even though they slept most of the night. They got at least 8 hours, 7-8 hours sleep that night, but they are still tired. So in severe depression, we see global insomnia, which is there are problems falling asleep, staying asleep, and they feel miserable when they wake up in the morning. Now, the other symptom is decrease in energy level. The general level of energy the person has usually is kind of stable for most people. And if there's an important, significant decrease in energy level, that person might be developing depression. After lower energy, also feelings of worthlessness, helplessness, and feelings of guilt. Blaming someone, a person blames themselves for different reasons. They find always a reason they did wrong or they should have done, and they blame and feel guilty for what they have done or some things that they haven't done. And also decreased in the focus and concentration is another symptom we see commonly in depression. Psychomotor agitation, or the opposite, slowing down or psychomotor retardation. Person can be more restless, irritable, agitated, or they are just moving like in a day's very slow pace, which is not typical for them. And finally, having recurrent thoughts of suicide or feeling like, I wish I'd rather be dead. I don't want to live like that. So these are the common criteria, main criteria for major depressive episode. If someone do have 5 of those, they most likely may meet criteria for major depressive episode. Obviously, they need to see a mental health professional to get a formal evaluation and seek treatment if and when necessary. Thank you very much.